and for some reason the camera seemed to stop filming, so this will be part 2 thereof. But there is a distinct difference there, but that's going to be difficult to capture on camera. I'm trying to keep your face out of this.
It's alright if it's on there.
Alrighty. So let me get back to the pelvic spring test, and where they are leading to is that you're one of the interesting type who benefit significantly by putting on an SI belt. We tried that already, and spontaneously the feedback you gave me, there's that delay. So I take up the slack, impart a force, and the recoil is very slow. It's slow, and it's the amount of force. There's like a weak spring is the best way that I have of describing the phenomenon. If I didn't know you had hypermobility throughout, if I just looked at your body, didn't watch how you walked, didn't watch how you moved your hands and such, that would be a very surprising finding to me, to have that kind of behavior. But it's just not something that is communicated well on the camera. But let's take it into a functional mode. Let's put this on you again. All right.
Okay.
So here is a, stay there. Put your bum up. And so we're putting on an SI belt, which I rarely do on a male. Rarely do I have indication to do so. But in this example, it made perfect sense for me to give it a try. All right. So I want you to do the same thing you did before. It should be about the same amount of tension. And I want you to step down and walk around and just give us some feedback.
Right away, I just feel more even on both sides, and very sturdy. Like my whole body is just... I just have a nice core foundation, as opposed to just being like just loosey-goosey.
Yeah, that's very similar to what you said the first time.
Yeah.
Without any prompting, that is basically what you said.
Yeah.
And we know that you feel better when you work out. Your plan is to get back and do more Pilates. Mm-hmm. And I think that this will help you accomplish that. I think wearing this for a period of time is going to let you build up that core strength. But I truly think that part of the instability is based on an excess of the elastin, of that collagen that is more elastic. And I think you have a mixed hypermobility syndrome. We forgot to talk about the lumbar x-ray that you had, not a real clear x-ray. You brought a Xerox copy of it.
Yeah.
You don't have the actual films, but he did speak of a transitional vertebrae at L5, right?
Right.
And it would be nice if we could get that image better, or get the original film, because it really looks rather significant from the, the poor quality X-ray that Xerox that we have. But again, if we look at this in a big context, you definitely pronate in your, rear foot, midfoot, forefoot. Okay.
What does that mean? I'm coming in?
Yes. Yeah. Kind of the splaying out of the feet.
Do you recommend arches?
We'll talk about
Okay,
that.
we'll talk.
We'll get there. Okay.
Video, sorry.
All right. That's part of your hypermobility syndrome. Okay. And the knees felt pretty solid on the left knee. We're calling the left knee the normative knee. Felt pretty solid. Your hips did not act to me like they were hypermobile, but then the pelvis distinctly so. Your elbows, your shoulders. Can you show us what you can do with your arms, please, when you reach up and over? So that doesn't really speak to hypermobility per se, but when you come from behind, you certainly go a lot higher than the average person of your body size would do in a male, okay? So I would say that you have hypermobility in the shoulders and in the elbows and in the wrists and hands. Do you have it in other parts of the body? We could test that in a little more detail, but I would still call this a mixed hypermobility syndrome. And to find someone whose pelvis is as hypermobile as yours, again, what did I tell you? How often does it happen?
Once a year.
Once a year. It's the end of October and you walked in the door. So
Just in time.
we'll have to give you a prize. So anyway, I think it's informative to for some find these to be informative, and I thank you very much for letting us film this.